Hepatitis B, caused by the HBV virus, is a liver infection that can manifest as either acute, resolving without treatment, or chronic, potentially leading to serious complications like cirrhosis and liver cancer. Globally, HBV poses a significant health threat, with approximately 887,000 deaths attributed to HBV-related liver disease in 2015 alone. According to estimates by the Centers for Disease Control and Prevention (CDC), in 2016, around 862,000 individuals in the United States are living with a chronic HBV infection. While HBV typically presents as a short-term condition in most adults with no lasting harm, a small percentage, 2.6, may progress to chronic infection, raising the risk of liver cancer. Alarmingly, about 90% of infants infected with HBV are prone to developing chronic infections. This video aims to delve into various aspects of HBV, covering transmission, early symptoms, and available treatments. But before we delve deeper, remember to subscribe and enable notifications for more engaging health-related content. And to help us come up with more health content, consider supporting our health outreach, link in the description of this video. So, what is hepatitis B? HBV has the potential to induce liver infection and inflammation. Notably, individuals can harbor HBV without exhibiting symptoms, thereby unknowingly transmitting the virus to others. While some may remain asymptomatic, others might only experience an initial infection that resolves on its own. However, for a subset of individuals, the condition progresses to a chronic state. In chronic cases, the virus persistently assaults the liver, causing progressive and irreversible damage over time. In 2017, the CDC received reports of 3,407 cases of HBV infection. Yet, considering instances where infections go unreported, the actual number of acute HBV infections might have approached approximately 22,100. Causes? The culprit behind HBV infections is the hepatitis B virus infiltrating the body. This virus is present in blood and various bodily fluids, making transmission possible through semen, vaginal fluids, and blood. Additionally, HBV can be transmitted from an infected mother to her newborn during childbirth. Engaging in unprotected sex and sharing needles are common risk factors for transmission. Moreover, individuals may contract HBV when visiting regions where the infection is prevalent. It's worth noting that carriers can unwittingly spread the virus since it often remains asymptomatic. Symptoms. Many cases of HBV infections occur during infancy or childhood, primarily due to transmission from mother to child during childbirth. However, diagnosing HBV in childhood is rare as it often presents with minimal symptoms. In children under 5 years old or in adults with compromised immune systems, symptoms of a new HBV infection may not be readily apparent. Among those aged 5 years and older, approximately 30-50 will display initial signs and symptoms. Acute symptoms typically emerge around 60-150 days following exposure to the virus and can persist for several weeks to 6 months. In individuals with chronic HBV infection, recurring episodes of abdominal pain, persistent fatigue, and joint discomfort may be experienced. Early symptoms. If HBV does cause symptoms early on, they may include 1. Fever 2. Joint pain 3. Fatigue 4. Nausea 5. Vomiting 6. Loss of appetite 7. Abdominal pain 8. Dark urine 9. Clay-colored stools 10. Jaundice or yellowing of the skin and whites of the eyes. Transmission. HBV is transmissible when blood, semen, or another bodily fluid from a person with the virus enters the body of an individual who does not have it. More specifically, infection can occur 1. When a woman with HBV gives birth 2. During sexual activity 3. As a result of sharing needles, syringes, or other drug injection devices 4. As a result of practicing unsafe tattoo techniques 5. By sharing personal hygiene items such as razors and toothbrushes. Health workers may be at risk through unsafe medical practices, such as reusing medical equipment, not using personal protection, or incorrectly disposing of sharps. HBV cannot spread through 1. Food or water 2. Shared eating utensils 3. Breastfeeding. 4. Hugging. 5. Kissing. 6. Holding hands. 7. Coughing. 8. Sneezing. 9. Insect bites. The virus can survive outside the body for at least 7 days. During this time, it can still cause infection if it enters the body of a person who has not received vaccination against it. Is it curable? Currently, there is no cure for HBV, but vaccination can effectively prevent initial infection. Antiviral medications are available to treat chronic infections. In instances where chronic HBV results in permanent liver damage, a liver transplant can offer long-term survival benefits. However, with the administration of an effective vaccine and the use of antiviral medications, the number of individuals requiring liver transplants due to chronic HBV may be significantly reduced. Treatment options. There is no specific treatment, cure, or medication for an acute HBV infection. Supportive care will depend on the symptoms. Treatment for suspected exposure. Anyone who has had potential exposure to HBV can undergo a post-exposure prophylaxis protocol. This consists of HBV vaccination and hepatitis B immunoglobulin, HBIG. Healthcare workers give the prophylaxis after the exposure and before an acute infection develops. This protocol will not cure an infection that has already developed. However, it decreases the rate of acute infection. Treatment for chronic HBV infection. For chronic HBV infection, antiviral medications are available. While these medications do not constitute a cure for chronic HBV, they effectively inhibit the virus's replication, thus thwarting its advancement into severe liver disease. Individuals with chronic HBV infection are at risk of rapidly developing cirrhosis or liver cancer, often without warning. In cases where access to adequate treatment or facilities is lacking, liver cancer can prove fatal within months of diagnosis. Regular medical evaluation and liver ultrasound every 6-12 months are essential for individuals with chronic HBV infection. This monitoring regimen enables healthcare professionals to assess the progression of liver damage and the worsening of the condition accurately. Hepatitis BVs, Hepatitis C. Hepatitis encompasses various types, including both HBV and the hepatitis C virus, HCV, which can manifest as acute or chronic infections. The primary distinction between HBV and HEV lies in their modes of transmission from person to person. While sexual transmission of HBV is uncommon, it primarily spreads through contact between infected blood and non-infected blood. Hepatitis B during pregnancy. If a woman is infected with HBV and becomes pregnant, there's a risk of transmitting the virus to her baby. It's crucial for women to inform their delivering doctor about their HBV status. Upon birth, the infant should promptly receive both the HBV vaccine and HBIG, hepatitis B immunoglobulin, within 12-24 hours. This swift intervention significantly diminishes the likelihood of the infant developing HBV infection. The HBV vaccine is safe to receive while pregnant. Prevention. People can prevent HEV infection by 1. Wearing appropriate protective equipment when working in healthcare settings or dealing with medical emergencies. 2. Not sharing needles. 3. Following safe sexual practices. 4. Cleaning any blood spills or dried blood with gloved hands using a 1:10 dilution of 1 part household bleach to 10 parts water. How long does the vaccine last? According to the World Health Organization, WHO, the complete vaccine series induces protective antibody levels in over 95% of infants, children, and adolescents who receive it. Moreover, the immune memory triggered by the HBV vaccine can endure for at least 30 years in healthy individuals. Nonetheless, ongoing studies aim to ascertain the duration of protection conferred by the vaccine. Are there side effects? Many individuals tolerate the HBV vaccine well. According to the CDC, the most common side effects of the HBV vaccine include fever and soreness at the injection site. Additionally, swelling, redness, and hardened skin at the injection site may occur. However, it's crucial to note that very rarely, the HBV vaccination can trigger a severe allergic reaction known as anaphylaxis. Is the vaccine a live virus? The HBV vaccine contains no live virus. This makes it safe for women to receive during pregnancy and lactation. Complications of hepatitis B. B infections can cause a range of life-threatening complications, including 1. Cirrhosis. This causes scarring on the liver and inhibits liver functions. It can lead to liver failure. 2. Liver failure. Also known as end-stage liver disease, this can progress either rapidly or over a longer period. The liver cannot replace damaged cells or function. 3. Liver cancer. Chronic HB increases the risk of liver cancer. Although HBV is a significant health concern around the world, for most people, the vaccine offers effective protection against the virus. In conclusion, being aware of the warning signs associated with hepatitis B is paramount. Whether it's fever, soreness, or other symptoms, recognizing and promptly addressing potential indicators can make a significant difference in managing this condition effectively. Remember, early detection and intervention are key to preventing serious complications. Stay informed, stay vigilant, and prioritize your health by not ignoring any warning signs related to hepatitis B.